Hi, my name is Dr. Anoki Khanum from the Apple Tree Pediatrics, and I'm here today to talk to you about fever. People often misunderstand the concept of fever. True, it is very intimidating and frightening if you're a parent of a young child who has a temperature of 39 degrees centigrade or 103, 104 degrees Fahrenheit. But what exactly is fever? And what is this fever doing to your child are the questions you should be asking yourself. Fever is a result of a coordinated cascade of events resulting in the release of inflammatory hormones in the body, which is usually a reaction to, in most cases, an infection of some sort. These inflammatory hormones in the blood then go to the brain and reset the body thermostat. This in turn tells the body it is too cold, it's time to heat up. As a result, your heart rate goes up, your respiratory rate goes up, and your metabolic rate goes up. This is all meant to increase your body temperature and can cause a lot of discomfort in the child. But one must always remember that all of this is caused by something else, which is usually an infection. A lot of parents focus on temperature, on the fever of the child. They call in panicking, my child has high temperature cannot go down, what do I do with this temperature? But what you need to be asking is what is causing the temperature. Temperature itself is of little consequence. In a normally fit and well child, a temperature will do no damage. So it is therefore the underlying cause or the infection that we need to be concentrating on. So why does our body do this to us? Why does our body raise its temperature in cases, for example, of infection? Recent studies have actually shown that a moderate increase in body temperature actually benefits and helps us in fighting an infection by reducing the growth and the multiplication of some viruses and bacteria. It also in turn stimulates the immune system to some degree. So a bit of temperature is actually not a bad thing. So how do we treat a fever, and should we treat a fever? Now the first thing to remember is that we need to understand the underlying cause. That's the first management of fever. If the underlying cause is bacterial, do we require antibiotics? If it's viral, do we just need to wait and ride it out? So the only time to treat a fever is if it's causing a lot of discomfort in your child. The first step in managing the temperature is to increase the fluid intake, so make sure they're drinking well, and to reduce their metabolic rate, make sure they're resting enough. Removing warm clothing helps cool the body down. Remember, the body loses heat through convection from the skin surface. If your child is wrapped up warmly, the heat is going to go nowhere and the temperature will not come down. The child normally feels cold when they have fever because of this loss of temperature. Medications can also be used to help control temperature and are known as antipyretics. Paracetamol, or acetaminophen as it is also known, has a relatively long safety track record. It has been used as a fever medication for the past 70 years and is relatively safe as long as it's used appropriately with the appropriate dose. So ibuprofen is another medication, an antipyretic medication that can also be used, particularly if you are looking for an anti-inflammatory effect. Ibuprofen does have a low risk of stomach irritation and possible bleeds, but usually if taken within the recommended dosage and with food, the side effects are very rare. Ibuprofen and paracetamol are always measured according to weight and not according to age. Aspirin is strictly not allowed in children. It has quite nasty side effects if given. Sponge baths or cold showers are not helpful at all, and research has shown other than causing increased discomfort in the child, do absolutely nothing to bring the temperature down. So remember, it's not the fever, but it's the underlying cause of the fever that needs to be treated. However, there is an exception to this rule. The exceptions are babies under 3 months. Babies under 3 months very strictly should not be having fever. You should not be giving them any paracetamol or ibuprofen without speaking to your doctor. If a baby under 3 months has a temperature above 38 degrees centigrade or 100.4 degrees Fahrenheit, they need to go immediately to their local pediatric ER. Fever under 3 months of age is an indication of a possible blood infection and requires absolute urgent treatment. Another exception to the rule is children between 4 and 36 months if they have a temperature above 39 degrees centigrade or 102.1 degrees Fahrenheit without an underlying cause, without any runny nose, cough, diarrhea, vomiting, with nothing that could be indicated as a cause for the fever. These children need also a rapid review by their local pediatrician. Children between the ages of 37 months and older, if they have a temperature above 39.5 or 103.1, again, without a focus, without an underlying cause, they too need a rapid review or an urgent review by their local pediatrician. Any temperature, any raised temperature or fevers lasting more than 4 days need to be reviewed by your local pediatrician if they have not already seen the child. So just to recap, fever itself is not an illness. Fever is not something you need to be afraid of. Fever is not something that needs to be treated unless the child is in discomfort. What needs to be done is an underlying cause sought and the decision made whether that needs treatment or not. The only exceptions are babies under the age of 3 months, because that fever may indicate a blood infection and therefore require an urgent review and treatment. And in older children, if they have high temperature without any apparent underlying cause or reason for infection or fever. My name is Dr. Anoki Khanam from the Apple Tree Pediatrics, and I hope you found this little presentation helpful. Thank you.